Hello, this is Dr. Do again. This video is on alphabetic dictal problems on letter L, and I had several videos on the lung diseases, including asthma, pneumonia, or any other, quite common lung diseases. Today I'm going to talk about another group of conditions called limb pain. Limb pain is because it's quite common. Here, there, we probably have it all the time, every day. But I'm just going to talk about some special causes and what are the signs to look for to indicate that it is quite serious. So first of all, let me just bring up the information, the symptoms or the signs or associated conditions that warrant emergent visit associated with this limb pain. First of all, regardless of young or old, injury. I'm not talking about the bump somewhere, had the bruise. I'm talking about the serious injury, trauma. So associated with probably swelling, limited range of motion, and very pain or a change in the sensation. So these are the emergency situation after the trauma. Go see your physician. Go see the emergency room as soon as possible to identify this, to see how severe the injury is and to identify the situation. And also for another cause of this limb pain associated with the emergency situation is deep venous thrombosis. I think I mentioned in previous video, I talked about the lung disease, talked about the pulmonary edema. I mentioned this DVT, deep venous thrombosis. It's asymmetrical swelling of the leg, feel pain, coldness. So this is also another emergency situation. You need to see the physician. And for another group of conditions with genetic predisposing factors like through hemophilia or the sickle cells or immune deficiency diseases might have the infections associated with fever. And some other conditions like the hemophilia or sickle cells cause this bone pain may or may not involved in the fever, but still it's kind of emergency. You need to see the physician as soon as possible. So this is about the general emergency situation associated with the limb pain. I think is I can think right now. And also for is there any associated condition you can manage at home? The limb pain, can you manage at home? Of course, I think we do it all the time. Here, there, a little sore after waking up in the morning, after you run a marathon or a couple miles, and or after the Saturday night party, you feel limb pain somewhere. It happens all the time. So you can little massage by yourself, taking some over-the-counter anti-inflammatory or pain medication to see. Usually it will recover, right? But if not, the situation is like this. If after you take care of yourself using the over-the-counter medication or rest or massage didn't improve, then probably you need to see a physician, probably can identify something serious going on and then to start treatment with the prescribed medication. So this is about, in general, the two ends, the emergency situation or the home management. Just in general, what are the causes for the limb pain in addition to this trauma or the emergency conditions I just mentioned? Depends on the age group. For the young group, usually by the limb pain without any predisposing factor, without any known diseases, probably it's from the trauma for the most, or the strain, muscle strain, quite common, either upper or lower extremity for the young people, or for the infections of the soft tissue, of course. Then you can tell it's not just the pain, also have the local redness, and feel warm, and probably on top of the small injury or trauma, probably insect bite, for example, and then cause this kind of swelling and pain. In terms of young people, can have joint pain, different causes. For those, you need to see a physician, regardless, either the infection, cellulitis, or the joint pain, which are lasting for more than a couple of weeks and without any identified causes, without any identified injuries. You need to see a physician to get diagnosed and treated. For the older people, the for the older, particularly for those who have other diseases like diabetes or hyperlipidemia, in addition to the DVT I mentioned, and also so the infection is one of the common cause, particularly in diabetic patients. The infection could be from very minor, like I said, the little scratch, because the diabetes, long-term diabetic patient lost the sensitivity of the peripheral nerves. So a little trauma, they did not feel the pain unless the infection is getting serious. They start to feel the pain. Not like common people, like the normal person, the pain kind of sensitive, so can start early to feel the pain, to treat early. But for those people, so you need to watch out every day, on a daily basis, check your skin, and from toe and also to the leg, make sure there's no even though superficial small injury or trauma for those long-term diabetic, particularly blood glucose and HA1C is not well controlled. So you need to notice your physician even though for little trauma, and then start to treat early to prevent deeper infection. So this is about this group, and also for the other comorbidities like the rheumatoid arthritis or thrombosis like DVT I mentioned earlier. For the joint pain, it's really for the older people, different causes, and I'm sure you have been following with your physician. But if it is new onset for the older people, even though without any systemic disease, the joint pain, I think you need to see your physician to identify either from degenerative change or from other causes, and then to start treat early to prevent and to slow down the progress of this joint pain. So this is about the limb pain associated with comorbidities for the older people. And there's another group of limb pain which really associated with the systemic, like back pain, just the aching pain without causes, without identified traumas, without family history, without systemic diseases, just the aching pain. And especially for long lasting, it's not 1 day, 1 week, 2 weeks, more than 4 or 6 weeks, still have the aching, generalized aching. For the female, probably you'll consider some psychological, like depression or stress caused, or the fibromyalgia also is another cause for this limb pain, generalized just aching. So if that's the case, you need to see your physician to diagnose, to exclude serious condition and to treat with either antidepressant or any other medications. For the, I think this is about in general for limb pain. I can think of quite, I think not very serious. Some of them could be serious, but it's still really need to be managed by your physician. It's not that something like a little bruise you can use ice pack to manage at home. So this is about a summary of the limb pain, the most serious causes, and also how to manage them, what kind of signs you need to see your emergency department or talk to your physician, what kind of conditions that you can manage at home. So this is just kind of put everything together, very superficial. I hope it helps, and thank you for watching. I will see you next time.